Hello, OA friends. Welcome to Inside OA. My name is Meg, and I'm a compulsive overeater and food and sugar addict. Today, I have the wonderful opportunity to meet with Blair. Currently, she is serving as a trustee on the executive committee. She's from Massachusetts, which is in Region 6. Blair first came to OA in 2015, and over the course of these years has served on the intergroup, which is a service body, the region, and world service levels. Thank you, Blair, for being here today. We're going to be talking about doing cool things in PIPO. So let's start out. What in the world is PIPO?
Yeah, thanks, Meg. That's a great question. I think a lot of people get scared about this acronym. PI is public information and PO is professional outreach. So PIPO is public information and professional outreach.
And what is the difference?
Yeah. What does it mean? So public information is exactly that. It's for the public. It's for people who aren't in the rooms yet or at all, who were teaching about OA or saying this is what OA is. Professional outreach is more on the professional side. So anyone that you see medically, clinically, psychologically, trainers, all sorts of things, different types of professionals that we can give outreach to are clinicians, so physicians, nurses, PAs, physician assistants, NPs. And then we've got occupational therapists, physical therapists, social workers, psychiatrists, psychologists. And then we've got like physical therapists, like I said, occupational therapists. I think I may have said occupational therapy twice, but that's okay. They're really important. Trainers at your gym as well. All of these folks can be the professionals that we reach out to tell them about OA and share with them what we've learned.
Oh, that's awesome. So now you're talking about doing cool things. So what are they?
I feel like every time I hear about PIPO, I get a little scared because it's so daunting to do this work. And I want to tell the fellowship that actually, if you break it down into small pieces, it's really manageable. And it doesn't have to be a $50,000 campaign to reach people. That's one of the things that I wanted to mention because PIPO could be very small. It could be you going to your gym and telling your personal trainer about OA, leaving some brochures at the front desk if they allow that, right? That's PIPO. Another thing, I'm sure we'll talk a little bit more about specific examples, but another small thing that one can do as a person or as a service body is buy some of our OA approved literature and put it in libraries with a faceplate or like a sticker that says where your service body is, or put in a little meeting list or something like that, or a contact number. That's a great way to donate to libraries our books so that we get them on the shelves. People start seeing them. They pick them up when they're just walking around the library, and then also get some information if they'd like to reach out and learn more.
That's great. I think of one thing that I do because we have a professional folder. I have those in my car when I go to a doctor, like a specialist. So, for example, I'm going to get my hearing tested in a week. And so I'm going to bring one of those in with me and go from there. We all go to all these people. I can do that as a powered in one. I love doing that on the individual level. So, how else can we get the word out? If we do it and then we think, I feel like I've done everything I can. Now what?
Now what? So it would be great. Like another way to have fellowship is also to combine with other service bodies to do a larger PIPO campaign, pulling together funding, applying for funding at your intergroup region, that kind of thing, to do a larger campaign. So that could be bus ads, like something big on a bus, like a city bus that drives around the city all the time. New York City, for example, or LA. Put a billboard in LA. Everyone drives there. So they'll see that billboard. Billboards aren't cheap, but so many people drive by that. They have to see it. And someone might be looking up and seeing the information that they need to see. And so those are much more expensive, but also have a much wider reach, right? than your one off to your medical or other provider. Another thing is that in Region 6, there was a great campaign for PIPO. And when I say campaign, it's a description of the initiative that one would want to do to get the word out. And so they did gas pump ads. Everyone gets gas, a lot of people, not everyone, because we have electric cars, but think about putting it on the electric car kind of plug in, if you will. We have those all around too. So putting an ad there where everyone just sits and pumps their gas. Perfect. It's perfect. QR codes, something simple, something that catches your eye quickly, right? Because putting in all the text isn't going to help you when you have 5 minutes to pump your gas. So a QR code might be useful there, or something like, is food a problem, question mark, right? Or put that flyer with the plate that you pull off the little individual phone numbers. We could make that work for something like an ad too. It doesn't have to have the physical pull off. So that's another idea. Transit buses, like I said, trains, all of those things, great, great places. And community locations. You're thinking about your pharmacies or your food banks, like all sorts of things. The sky's the limit, right? Like we think about it, you do it, right? Or we do it. We also all do it. And so I think the key is not to get scared and to really recognize that it can be a small step. It could be a brochure in a supermarket. It could be the food is a problem poster, or you could ask for airtime to play the PSA videos, the public service announcement videos, right? I don't know if anyone's had success in doing that, but I know that we've tried. I think getting airtime, at least on the radio, is probably more likely than TV, but I'm sure there are people out there that know who to contact and can use those opportunities to show folks about OA.
Well, that's great. So I'm here in the Midwest,
Mm,
and there's a lot of space between cities, more so than out east. At least that's what
mhm,
we say when we think of out east. And we have done some things where you have the front and the back of the city buses. There's placard space for that. Also, we've done things on billboards. We've found real billboards where people actually paint the vinyl up there, and they're less traveled roads, but
mm,
you have more time that it's up and longer. Like I said, more time. And looking at options like that. Also, my group, we did this a few years ago, and I'm going to do it again because I'm going to be doing some traveling. But anybody who's in their car, and let's say you're going to be traveling a distance and you're going to be stopping maybe every hour or so to make a gas stop or biology break, and we have those stickies that say, "Is food a problem for you?" and put them in bathroom stall, because you really have a captive audience at that moment. And maybe it don't only last there for that day, but we all know sometimes it hits that right person at the right time. Who knows? But again, it's all affordable. So I'm thinking too, all of the things OA has, all of these items that we have that are small in cost, free, or that cost a little more. What types of things have you used off of the website, Blair, that you think about?
yes, that's a great question. I've used the pamphlets, the helping professions, how to speak to someone who is in the helping professions. Also, just general information, right? Because there used to be a professional packet, and that has our membership survey and a few other things in addition to the helping professions. And that's a great kind of one stop, hand the packet to your provider. I've done posters. I haven't done very expensive things, but we've done at health fairs, for example. This is one thing I didn't talk about earlier, is that we would have a table where we would put out literature in brochure holders, and folks would stop by as they walked through the conference. I think that is a really great opportunity, especially when we have nonprofit status, that often those tables can be for a reduced cost to support getting the message out. It could be as simple as two people standing there with some literature and saying hello to people as they walk by. Those types of conferences, they're all over the country. It doesn't have to be like a medical one. It could be a holistic conference, right? It could be chiropractic. You name it, it could be that. And so I think having folks think a little bit outside the box, if you will, could really lead to some great interaction with the medical professions specifically, and the helping professions as well, because I find that those groups know a lot about AA and know very little about OA in general. And so getting the word out is really important. Anything we can do, even one person, getting the word out to one person makes a difference. And I think that is something that's really important. We don't have to be scared about the volume of people we want to approach or reach. Start small and then gain some momentum and get some other fellows involved, get some other intergroups and service bodies involved, and then maybe apply for funding for those billboards or other things, right? Meg, what you were saying about the website is that we have so much there. And I think that I only know a very little bit of what's there. I think there's so much more. And I think I personally, every time I go onto our website and resources page, I see more. And so I think that's another thing that folks can do both personally and in their service body is look at the website, see what's there, ask questions, go to your local colleges, right? Weight management and health fairs. Last year, the PIPO committee at the world level, we got a letter that we approved and is now online to ask nursing schools and medical schools if folks from OA can come talk to their medical students and their nursing students about OA. The goal is to get the information out during training because I often find that these folks don't have the training needed when approaching folks with our disease. How do you begin to talk about that? What I would love is to have a mock sort of patient with these folks in their medical careers, in their medical training, and be the sort of mock patient and help them talk to folks who have eating disorders and compulsive overeating, undereating, anorexia, bulimia, you name it.
Oh, thanks, Blair. I think a lot of times we have to look at this. What is our responsibility for this? Step 12 says we have to carry the message. So if a person is already in your meeting, a new person comes in the door, they already got the message. That is no longer outreach. That is work within.
I'll step
So
with it.
we are to get that word out. The other thing I think we get caught up with is that we have to find converts. And all we have to do is plant seeds. You just figure you've got that grass seed bag. And I know there's a lot of little grass seeds that fit into a grass seed bag, but you can say maybe a 1 pound bag. It's like, how many seeds are you planting on a weekly basis? I'm not saying you go into a grocery store and you see someone and you think, they could sure use this program. I'm going to go up and talk to them. It's about how can we do this as a community and in a place that it is appropriate and well received. So for
Mm,
example, I've done my share of health fairs. And there's one thing when you are doing it and a person who may need OA or is thinking about it and feels vulnerable and doesn't want to see them walking up to our booth or table or whatever. But I did one where it was for social workers. And so it was easy to say, you may have clients who experience this. The same thing with healthcare professionals. It's a third person approach. And so sometimes it's starting with that. I'm looking at our OA.org website and there's tons of statistics that you can use. One of them is we do a survey every 10 years, and one of them highlights like life improvements. So we've got an amount that your life was significantly improved, moderately improved, and then a total with those two there just by going to OA. And again, there's no dues or fees. It is fully self-supporting. That's the other draw. But for example, like mental emotional health, significant improvement, 76% of the people had significant improvement. Or weight issues, 53%. And some had moderate improvement, 27. So it's really about finding community and being a part of a community. This is the extension of that. Like you said, Blair, it's like we work in a community. So we work in a service body, or we work with groups of service bodies to then pool our person resources and pool financial resources if we want to spend more money on something. So, what kind of skills do you need to do that? I don't know how to create a website or create a fancy flyer.
Luckily, one person doesn't need to know all this, right? Like, all you need is some excitement about OA to walk up to a person that you see at a medical conference, right? Or a health fair, go into a library with a book and say, can I put this on your shelves? You don't have to sell anything. There's no selling, there's no promotion. It's just that here is our information. We'd love to put it on your shelves. And that's it. You don't have to have computer skills. That's the beauty of being in a fellowship of people who got in recovery from this incredible disease. We all have outside lives, and some of us have skills and can help you put together a flyer or figure out how to put together a website. Or if we don't know how to do it, we can know someone to ask. And so I think the key here is let's not get scared about those big, huge projects today. Let's focus on the smaller things that we could do, baby steps toward this, get a little momentum, see how much you could change someone by giving this literature, for example, and then move from there and bring in your fellows, bring in your friends. And you'd be surprised how many skills people have, but you do not need computer skills or website skills to do PIPO.
No, and that's great. And I also want to talk about there is a beautiful service manual called Public Information and Professional Outreach Service Manual. I think it's $20 US. And again, this would be something that your service body would buy. Yes, you can buy your own personal one if you'd like, but it is chock full of ideas. And what's cool is these are ideas that came up with fellow compulsive eaters. So it's not someone who doesn't know anything about food distress or whatever. It's about all of us. And it was just updated. In fact, Blair and I worked together with the committee that did this work. So that's the cool thing. So we're pretty excited about this and pretty invested in it. The thing is about doing PIPO work, outreach work, is the fact that we're getting the word out there and we're sharing. We are supporting our organization by letting people who don't know about us. And it's not that, yes, I go into a library and someone might say, that's breaking my anonymity. I'm not going around and saying my first and last name, and I have my iPhone up and I'm filming myself as I walk into the library so I can post it on my social media. No, I'm just walking into a library and saying, I belong to this organization. Would you be willing to accept the gift of this book and put this in your stacks? Or I just go into a coffee shop and there's a bulletin board and I happen to have a little baggie of thumbtacks and I stick up one of the beautiful 4-color glossy paper cardstock pull tabs that have the phone number of OA on there that someone could go and drink in a cup of coffee and they can quietly just take off a tear strip and find out about us. It's really sharing the miracle that we found by walking in this room with someone else. It's not really, I don't see, we can say paying it forward, but my real philosophy is this: we're making living amends.
Mm.
We are making amends to ourselves and all the time that we suffered in this when we weren't in this program. And really, it's doing a kindness in our future and making that available for someone else. So, again, go to oa.org. You can go to the document library. We'll have more information down below. But, Blair, do you have anything else that you'd like to add?
I just want to share again that it doesn't have to be huge and big, your campaign, if you will, like you're bringing out to other folks. If you reach one person, like Meg, you were saying, planting the seed, like the grass seeds, right? We're never going to know who actually got the message. And that's okay. That's part of the process. I personally got into PIPO because I wanted to give back. I wanted to shout on the mountaintops about OA. Sometimes I can't really do that. So this is another way to do that, right? Like I'm putting ads in places, or I'm going to libraries or newspapers, or trying to get an ad on the TV or radio. And all of those things, they help your community. And that's the key. That's where we live. And we want our communities to succeed and be healthy. And however that means, if we can share some of what we got in the program with others, that's even better.
Thank you so much. And I just want to put out a challenge to those of you who are listening today. Even with your group, why don't you just create a contest or a campaign and say, we have a group of, let's say, 10 to 15 people, even if you have 5 people, and to say, you know what, we're going to get those flyers, pamphlets, or whatever from OA, or we're going to print the free ones from OA.org, and each one's going to hand out 2 within the next week or the next month, and see how that, and then share that experience with your group. And again, see how that feels, and can you ramp it up a notch and try something else? So thank you so much, Blair. It's so wonderful to know that we were able to do service together in the past, and we are again now. And thank you, everybody. And we'll look forward to sharing more information next week.